Hello, good morning. Today I am going to present a research article. It's a knowledge about cervical cancer and its prevention among female students from a private university in Perak, Malaysia. I am Dr. Sandeep Sugadan from the Department of Community Medicine, Manipal University College, Malaysia. Okay. Introduction. Cervical cancer is a major public health problem. It is the seventh most common cancer in the world and the fourth most common cancer among women. Cervical cancer is the ninth most common cause of cancer death in the world and the fourth most common cause of cancer death among women. Cervical cancer in Malaysia is the third most common cancer among women in Malaysia. And another important finding is that 41% of cervical cancer patients in Malaysia present at a stage 3 and a stage 4, lowering the chances of survival. And 93% of cervical cancers is preventable through vaccination and regular screening programs. So it's a preventable cancer. A vast majority of women in Malaysia are reluctant to do the test due to lack of knowledge about the importance of screening, according to the studies done by Subramaniam in 2019 and Wong in 2009. The objective of the present research is to assess the knowledge about cervical cancer and its preventive measures among female students from Quest International University, Malaysia, and its association with various socio-demographic factors. Now we can go through the methodology. It's a cross-sectional research done among 161 female students from Quest International University. It was using a validated questionnaire. It is Cervical Cancer Knowledge Prevention 64 questionnaire. Questionnaire was distributed using Google Form. The study was carried out from June 2020 to February 2021. Convenient sampling method was used. Descriptive statistics and a chi-square test was used for analysis. Ethical clearance was obtained from Joint Research and Ethics Committee. Okay, these are the results. General knowledge about cervical cancer in the studied population varied from 68.9% to 86.3%. The general knowledge and awareness level was quite good. Knowledge about risk factors. Okay. Participants identified HPV infection, early initiation of sexual activity, multiple sexual partners, history of sexually transmitted infections, and cervical cancer in the family as the risk factors. The knowledge about risk factors was also quite good. Knowledge about primary prevention and vaccination was good among the participants, and it varied from 56 to 65%. But knowledge about free availability of human papillomavirus vaccine was quite low. It was around 36%. 49.1% of participants got vaccinated with HPV vaccine in our study. 44.7% of participants were aware of the correct age of vaccination. Knowledge about symptoms was quite good. It varied from 50.9 to 74.5%. But knowledge about cytological examination was quite low. It varied from 7.5 to 28.6%. Okay. Now the inferential statistics results showed that knowledge levels were significantly higher among those students from Faculty of Medicine, those students with a health science background, and those students who were having high family income. Now we can go through the discussion. Another research conducted on knowledge on cervical cancer, its screening and vaccination showed that majority of the students had poor knowledge score about the topic. But in our research, the overall knowledge level was quite good. Another study was conducted. It showed that level of education and economic status were significant determinants of awareness regarding cervical cancer. It was similar to the findings in our study. Okay, these are the recommendations of the research. More health education sessions are recommended among university students. Correct age of vaccination and the importance of cytological examination needs to be emphasized. These are our references. Thank you so much for your patient listening.